everyone, and today we will review teaching and learning and the process of teaching and learning that is broken down into 4 steps. Learning is the act of acquiring new and reinforcing or modifying knowledge, behaviors, skills, or values. Nurses possess specific professional knowledge, skills, and values that make them well suited to teach clients and families how to care for their health. Although nurses can implement teaching to bring about learning in the client, learning can only be achieved by the learner. The teaching-learning process is an interactive, individualized interaction between the nurse and the client. And the teaching and learning process has 4 steps: assessment, planning, implementation, and evaluation. In the assessment step, nurses assess the client's needs, such as knowledge, skills, values that relate to the health behaviors and health problems. Once the assessment is complete, both modifiable and non-modifiable characteristics that influence the client's health problems and behaviors are identified. Non-modifiable characteristics include age, cultural background, and cognitive abilities, whereas modifiable characteristics include knowledge base, awareness of community resources, and more. During the examination of the client's readiness to learn, the nurse examines the client's motivation, attitudes, and beliefs, as well as being acutely aware of their own beliefs and values about the teaching and learning process, including client empowerment, and recognizes the client's potential barriers to learning, such as family dynamics, significant others, their home, work, and community environment. During the planning step, the nurse creates a plan to measure the client's achievement toward improving knowledge or health behaviors. This involves collaborating with the client about their learning needs, determines the client's priorities regarding learning, and writes out the client's behavioral goals or objectives that reflect changes in the client's behavior that are measurable and observable. In the second to last step, implementation, the teaching strategies are implemented through the optimal teaching strategy, such as videos, individual lessons, or group settings. The client is actively involved and in learning activities, and family members as well as significant others are involved if the client so chooses. Lastly, outcomes are reviewed after the plan is implemented, and this helps determine the effectiveness of the teaching strategies, whether the goals or objectives were met, and alters the strategy if the goal is not met. So that's it for today. Thanks for watching, and always remember, safety and caring are the hallmarks of nursing. Be sure to subscribe for more content like this.